Okay, good morning, everybody. Use that slight echo when you yourself coming back. I hope everybody's well. Welcome to the Health and Wellbeing Board for Shropshire. Great to see so many of you both here and online. For those that don't know me, I'm Simon Whitehouse. I'm Chief Exec of NHS Shropshire, Telford and Wrexham, and co-chair with Councillor Mockley. We take it in turns, but I'm chairing this morning up until around 11 o'clock, and then we're properly taking it in turns because I'm passing the baton over so I can just go and do a national call. So apologies that I'm stepping out around 11 o'clock-ish, but we'll leave you in the very capable hands of Councillor Mockley at that point. So if we finish on time, that will be because of how I've led the meeting at the start. If we finish late, it's because of how it's been finished at the end.
No pressure, no pressure.
I hope everybody is okay with that. Agenda's been published. Some really useful and detailed conversations for us and discussions for us to have today. Steer to presenters. Please assume we've read the reports and read the papers. So don't feel as though you need to take us through that pack, but really focus on pulling out the areas that you would want us to be discussing and want us to be talking about this morning, so that we can use the time that we've got on the discussion on the key areas rather than on going through the papers that have already been published, please, if that's okay with colleagues. And we'll keep moving at some pace and we'll keep going through as we need to in terms of making sure that we get the time. So I am going to go round the table, if that's okay, and do introductions because we've got people online, and also helps then in terms of accurate minutes and notes as well. I've done my introduction, so I'm going to go to my left, if that's okay.
Thank you, Rachel Robinson, Executive Director for Health at Shropshire.
Lynn Corley, Chief Officer, Health at Shropshire.
And I should have said, sorry, if you press the right button on the speaker bit in front of you when it goes red, you're speaking, and then if you can press it again when you finish speaking, then it comes off, then people online can hear us as well.
Hi, Jackie Jeffrey, Chief Executive of Shropshire and VCSA rep on the Health and Wellbeing Board.
Penny Basin, Head of Joint Partnerships, joint role, ICB, NHS and Shropshire Council, Public Health.
Good morning, Paula Mawson, Assistant Director for Integration and Healthy Population at Shropshire Council.
Morning, Laura Fisher, Head of Housing, Resettlement and Independent Living at Shropshire Council.
Good morning, all. Tracy Ryan, Chief Inspector for Safer Neighbourhoods and Problem Solving for Shropshire Police, representing Shrewsbury.
Michelle Dulson, Committee Officer for Shropshire Council.
Louisa Jones, Business Support Lead for Partnerships, Health, Wellbeing and Prevention, Shropshire Council.
Laura Tyler, Assistant Director for Joint Commissioning for both Shropshire Council and Shropshire and Region ICS.
Good morning, my name's Nigel Lee. I'm the Director of Strategy and Partnerships at Shrewsbury and Telford Hospitals, and also ICB, Director of Strategy and Partnerships.
Good morning, I'm Councillor Cecilia Mockley. I represent a rural division in the south of Shropshire. I'm the portfolio holder for Adult Social Care, Public Health and Communities, and co-chair of the Health and Wellbeing Board.
And let's do colleagues online on Teams as well, if that's okay. So I'm going to ask for some help because my eyes are good, but I risk missing somebody. So Louisa or Michelle, could you just take us through and so we introduce people or ask them to introduce themselves?
So, sorry. Kirsty, could you introduce yourself, please?
Good morning, I'm Councillor Kirsty Hurst-Knight. I'm the portfolio holder for Children and Education. And apologies, Chair, there has been an incident in a school in Oswestry, so I might have to pop off and take a call. But good morning, everyone.
Ben, could you introduce yourself, please?
Good morning, Ben Hollins. I work for Midlands Partnership University Foundation Trust as the Health and Wellbeing Strategy Implementation Manager.
Bernie, could you introduce yourself, please?
Bernie Lee, Public Health Lead, Shropshire Council, here for the Healthier Weight Strategy item. Thank you.
That's it. Sorry. Sorry. Apologies. Kathy, could you introduce yourself, please?
Hi, Kathy Levy, working with Bernie. I'm a Public Health Development Officer and like Bernie here for the Healthier Weight Strategy item.
Thank you. I think we've got everyone.
Yeah. Yes. Have we missed anybody on Teams who wanted to introduce themselves?
I think Gerald's just here to view.
Okay. Good. Okay. Thank you for that. In terms of apologies, I had apologies from Claire Parker, although she's going to be late rather than not attend at all, so she'll be joining us shortly. Apologies from Patricia Davis. Apologies from Dan Quinn, apologies from Tanya Miles, and apologies from Peter Crosby. And we have any other apologies from anybody we've not got recorded there. Nope. Good. And so Tracy, you're very welcome, and thank you for covering the meeting this morning. In terms of disclosable pecuniary interests, people will have updated their register of interests, I'm sure, but anything else relevant to the meeting that needs to be identified this morning? Nope, non-recorded, so thank you for that. So the minutes of the last meeting were held on the 14th of September. So thank you, Michelle and Louisa, for turning our conversations into minutes that accurately represent and record that. Always appreciated, so thank you for that. So firstly, for accuracy, I'm going to go through really quickly. Page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, and page 9. I'm going to ask that they are an accurate record, and on that basis, I would ask for a seconder to propose and support the minutes, please.
I'm happy to second.
Thank you, Councillor. And I'll sign those, and then we'll have the record signed as well. Were there any actions on the minutes that we don't pick up elsewhere on the agenda? I think it was more there was a lot to note and a lot that was coming back, so I didn't see anything obvious that I thought were. Louisa?
I have put an action in your report right at the end, so it's on the Health Watch, responding to the Health Watch report. So that's in your agenda, and you can just read it out.
So do you want to cover that now, or do you want to pick that up when I get to the chair's report?
Very much up to you.
It's a reminder, isn't it? So thank you for that, Louisa. So on the 15th of June Health and Wellbeing Board, there was a request in terms of an update. Partner organisations providing an update to the colleagues around the accessible information standard. There was a request that each lead from their organisation went back and provided an update against that. Can I remind colleagues that we've still got that action open because we've not had responses from everybody in terms of that accessible information standard. So if we could respond to that, that would be great. We've had responses so far from Shropcom and we've had a response from MPFT. So I'll make sure that the ICB responds to that, but if others can pick up that action, that would be great as well. Thank you. Okay, so minutes done, disclosable interest done, attendance and apologies. Public question time. So we've had a question from Mike Richardson, Shrewsbury Friends of the Earth. I'm going to read that out and then read the response as well, and then we'll get into the agenda proper. The question that's landed, once again, the Public Protection Officer's report to the board, although well-intentioned, contains no actual plans, commitments or target dates. Instead, we have a report that contains many consultations and contemplations, but no sign of implementation. Since 2010, that's 13 years, when UK legal limits were introduced, there's been a failure to solve the problems within UK limits, which are currently set 4 times higher than the latest WHO recommendations. And the question that supports that then is, instead of vague plans without definitive timescales, when will the board demand decisive action with targeted dates? And the response that will also be published from Shropshire County Council. The Council have commissioned reviews of both Shrewsbury and Bridgnorth's AQAPs, which are currently being undertaken by specialist contractors at Bureau Veritas. There have been delays to this work as set out in the 2023 Health and Wellbeing Update, November 23. However, this work is now rapidly developing and we anticipate completed AQAPs by early 2024, outlining plans for effective and quantifiable reductions in both areas. Shropshire Council continue to assess air quality elsewhere in the county as described in the update report. And I'm assuming, Rachel, at some point then, when those reports come back, there'll be a conversation that we'll have here with that update anyway.
they will indeed. It'll be brought back to the next board or the board as soon as after we have
Okay,
it.
so we'll capture that in the forward plan as well, so we'll get that picked up as well from there. Okay, thank you for that. I've not had any other public questions at that point. So I'm going to move to the agenda proper, if that's okay with colleagues. So the first agenda is the Health Watch Shropshire reports, NHS and social care complaints. And Lynn, I'm coming to you on this, I think.
I've just got a few slides to share with everybody.
And can I just check, colleagues on Teams, you can see the slides as well?
Yeah, that's coming through clear, thank you.
Brilliant. Thank you very much, everybody, and thanks for the opportunity to bring this report to the Health and Wellbeing Board. I've been off for a few days, so I'm not feeling 100%, so just bear with me today. That'd be really good. So you've all received a copy of the full report, so I won't be picking out items from the report specifically. The main thing I'm going to focus on is the reason why we did this report and also our recommendations. So for anyone who doesn't know, Health Watch Shropshire has been providing the independent health complaints advocacy service since 2016. This is a separate contract to the Health Watch contract. What I think is quite interesting is that there is no requirement for such a service for people who want to make a complaint about social care. So quite often, people who wish to complain about social care will use our resources because the process is almost identical, apart from the ombudsman that you go to if you remain unsatisfied. In all of this time, we have helped 884 people by giving them information about how to make a formal complaint, and that includes social care complaints. We've provided 195 people with advocacy support, and that is small A advocacy, so we don't complain on people's behalf, it's their complaint, and our role is to empower them to have their voice heard. But what I think is quite striking is that in all of that time, we've got less than a handful of people who've reported to us that they felt satisfied with the outcome of their complaint. Of the two that I recall, having been the person who provided this service, those were two people who actually had a cost of their prescriptions reimbursed to them, but no one else has reported that they feel satisfied with the outcome. And so I just want to share some of our reflections as the provider of this service, which I think really feeds into the outcomes of this report. When we speak to people who are using the formal complaints process, the thing that is most difficult for them is poor communication, or when they do receive communication, the tone, the language that's used, and often the lack of empathy for their experience. Many people report that this is a really grueling process. It's long, it's often unsatisfying, and people get very anxious and distressed about it. And many of these people have experienced what they consider to be a traumatic experience or a bereavement. And unfortunately, the complaints process can just make that worse. So many people talk about sitting at home, waiting for the post, waiting for a response, and then how they feel about opening that envelope. And I'm not entirely sure that's always considered when people are writing these letters of response to people. But also meetings themselves to discuss the complaint can also trigger those feelings and that trauma. So we've heard of people who've been invited into the same environment where the event happened. Either the ward or clinic where they lost a loved one, might be where that complaints meeting takes place. So everyone who we've worked with feels that more work needs to be done to show the public what difference their complaint or their feedback has made on the experience of others. And having been to so many meetings across our system, I feel that this work and this report feeds into quite a few other pieces of work happening across our system. It feeds into the work around the accessible information standard, which Simon has mentioned, in terms of those responses to people's complaint, checking that people understand the information that they're given, not only in letters, but in meetings. because quite often it's very technical information and sometimes it's information they don't need. I think it feeds into work around advanced care planning, respect, and having difficult conversations, particularly around death and dying. So a lot of people who have been bereaved, it's because they weren't prepared or they weren't given the information they needed to prepare for that bereavement. It's about having a trauma-informed workforce, remembering that a lot of people who come to make a complaint have actually experienced a trauma of one form or another to lead them to that position. And it also, I think, feeds into the work around personalisation and considering the impact of an experience on an individual. So just to pick up on this piece of work in itself, what we also find is quite often the complaints process is a bit muddled because people don't always understand who is the provider of services. Quite often within our integrated so it can get a bit confusing about who is the provider of a service that's being complained about. And so if the providers themselves also don't understand, it can be even more confusing. So this was somebody who complained about a GP practice, and rather than them being directed towards NHS England at the time, and now obviously the Integrated Care Board, they were referred to the Community Health Trust, who has no responsibility for commissioning GPs. We've seen very, very long letters where every single person spoken to offers their condolences, and the person receiving that just felt that it was almost patronising. It just became a very hollow response, because every sentence was, we offer you our condolences, we offer you our condolences. And that isn't really what they needed to hear. They needed to get some answers to their questions. We've seen letters that have an extraordinary level of detail that's irrelevant to the complaint and actually is very confusing to the person trying to understand. But some of the most difficult cases are where someone has made a complaint about a service. They are offered reassurances that action's been taken to prevent it occurring again. And then even in their own family, the exact same thing happens and nothing has changed. And to the point where they receive almost identical letters to the same thing that has happened to somebody else in their own family. So we use this as an opportunity to just bring together people's experiences, to find out what's working and what doesn't work for people. We know that complaints are based in legislation and how they're managed and handled. And in 2022, the Ombudsman developed the NHS complaint standard, which sets out a single vision for what should happen when a member of the public makes a complaint. And nationally, there is a push towards making complaints processes easier for people, and there being one complaints procedure across an entire integrated care system. So the standard is very simple, really, and I think as a system we get it. So we know that we need to be welcoming complaints as a positive way of receiving insight into what we're doing and how we can improve. Supporting a thorough and fair approach that accurately reflects the experiences of everyone involved. Complaints are very subjective. And so it's not helpful to dispute someone's perspective on what has happened. It's about accepting that perspective and moving forward rather than challenging it. Encouraging fair and accountable responses that are open and honest to the questions that are being asked, but also how we promote a learning culture, not just within one part of our organisation, but across our whole organisation, and then ideally across the whole system, so that providers are sharing their learning with each other. And in developing the standard, the Ombudsman spoke to the NHS, organisations providing services, as well as members of the public and advocacy groups. So the whole purpose of this report really is to highlight really how we're doing against those standards and to implore organisations to embrace those standards. So I will share these slides. I think for me, I'm just going to skip through quite a number of these. One of the things that we also wanted to pick up on is why people chose not to make a formal complaint. People reported feeling that it wouldn't make a difference. And quite interestingly, we get this a lot amongst people who contact us. People worry that will affect their future care. And we can't guarantee to them that it won't, because we've seen it happen, unfortunately, where people, if they do raise a concern, people are then open and frank with them and refuse to work with them because they've made a complaint previously. And that is not expected. It's not the desired approach, but we also know that it can happen occasionally, which is unfortunate. But also people have had a previous experience of complaining where they feel that it didn't make a difference. So for me, this whole report represents an opportunity for our system to demonstrate to the public all the work that I know is happening to try and improve people's experiences of complaining. Unfortunately, when we went out to the providers, they didn't always explain what I know that they are doing already to try and improve things. So quite often in responses to our report, people talk about how it's helpful to hear these experiences, how it's a basis for action being taken. But I would really implore organisations to take more time to say what they're already doing, the impact that that's having, and what they're planning to do next. Because I do feel that this was a missed opportunity in this report. And I think that's probably all I'm going to say.
Thank you, Lynn. So, I mean, the report is comprehensive and detailed, and then the presentation helps bring some of those aspects to life. So, any initial comments, views, thoughts? I've got a couple, but I'll open it up first, if that's okay.
I was just thinking when you were talking, Lynn, what our work on person-centred approaches could do to involve this part of our work as well, because I'm not sure that I really thought about the complaints and the way we work around complaints being person-centred as well, but of course it is about everything that we do, including that. But then also that approach might also help us, because the premise behind person-centred care is around reframing our relationship with the public as health and care providers, and around having that strengths-based conversation, but also that equal conversation. So it's around, and I just sort of think that might also help the public in their the way they view and use and consider health services as well, because it is a two-way thing, isn't it? It's a relationship, and I just think that person-centered approach that might involve this might really help us develop that relationship with the public.
Yeah, one of the things that I think I'm very conscious as someone who provides this service that an enormous amount of time and money is spent in our system responding to complaints. And actually, I think the complaints process isn't always the right thing for the public. So if we speak to them soon enough, we can talk to them about how it won't meet their expectations, and how it won't bring somebody back, for example. And I think there needs to be greater investment in bereavement support for people, better signposting to that support, but also better support for people's psychological responses to what has happened. So I know that during the pandemic, for example, we used TRIM to support staff. And I think the emotional support that is hopefully available to staff should be extended to the people who've had negative experiences, because that would help them deal with it. Because some of these people sit in our complaints process for years on end and remain unsatisfied, and they bounce back and forth. But if I spoke to a woman who had basically been dragged out of hospital. She'd been in hospital. She felt that she needed to be in hospital, and she'd had to be forced out of hospital. I went to see her at home. Her husband had gone out to work one day 15 years before and never came back. He died in a car crash. She wanted to be looked after. She wanted to be in hospital amongst other people, but it was based on her psychological need for attention, for care, and to be looked after. But if she'd have had bereavement support, she wouldn't have wanted to stay in the hospital because that was the only support she could get. She wouldn't have had to be dragged out of that building forcibly. And so I just think that if we have conversations with people and find out what they really need, we could avoid a lot of real pain for a lot of people.
So I know Nigel wants to come in, and I think it's a really important point in that. I guess my question to follow on from that, Lynn, would be, so I agree with that conversation and that focus, but then that isn't one of your recommendations.
No.
And I'm looking back now and listening to that conversation, it feels, I wonder if we've missed an opportunity, because actually I think there's a really important recommendation that both into, because you're right that, and look, from my organisation, I recognise by the time the complaint gets to my organisation, those people are probably frustrated already anyway, because they've already gone through one set to get to that. What I will say, recognising that we're in public, is that myself and my chief nurse see every single complaint and every single complaint response, and I sign them off personally and send them back many times before I'm happy to send it out with my name on. So I see every single complaint that comes through, and I ask my chief nurse through our quality committee and quality conversations and with my patient experience team to take that learning into them and come back with the view on trends, the view on where the delays are, the view on where the challenges are. But no complaint, unless I'm on leave, in which case my deputy signs them off, but no letter in a response to a complaint goes out unless I've read both the complaint and that response to put my name on the bottom of it in the first instance. And I'm sure that will be the same in many organisations. But I just wonder that, so your point there, and I read many where it wouldn't matter how we responded to the complaint, we're never going to make that positive response for what the individual wants, because what they're complaining about, whereas what we use complaints for is how do we demonstrate the learning to improve things going forwards, which can be really demotivating for the complainant because they want something different for what's happened to them or their relative or their friend or their family, whereas our view is we can't change what's gone on, we can learn from it though, and we need to learn from it. And that is in there as a recommendation, but that support for individuals, I think we might have missed that when you articulated that.
I suppose since I've been presenting this report and going to all the meetings I go to, and also my own personal interest in mental health, I just think so much missed opportunity.
I think it's fair. I'm going to come to Nigel and then Tracy before I put you on the spot and come to you. I just wonder if there's anything from a police perspective in terms of learning around complaints and that we might play into this conversation as well. But I didn't want to just come to you and put you on the spot. So, Nigel.
Thank you very much, and thank you for the report. I think it's always really useful to have these sorts of reflections and mirror, and I think it's particularly useful to do that as a whole system. I think the bit for me, as you were talking and having read, was actually the point which you alluded to about how we could do some of this work in a bit more of a joined up way, and including perhaps that learning, because we will have pockets of really excellent practice and we'll have areas of improvement that we all need to make, and that includes looking at across different sectors. I think the point actually, Simon, that you just made around the thematic approach, I think that's something which also we could usefully consider together, including wider communication, because we're on the cusp of introducing a thing called the Patient Safety Incident Response Framework, which again is a different way, certainly from an NHS perspective, of approaching that. The other bit I just considered was you were talking, and I think rightly, Lynn, about the ways in which we're trying to support staff, and that is in terms of challenges, but it's also a significant focus that we've all got about freedom to speak up, and that's exactly what we're talking about here. But freedom to speak up, not just using a formal route, but using the most effective route for solving or supporting individuals, which alludes to your point, Penny, about patient-centred care. A formal route is not necessarily the best way of actually even reaching a really good conclusion on behalf of the patient or the relative. So I think there's some areas there, but I think getting something where we bring a handful of key people together across the system, I think would be really good, and there's some real expertise across the patch.
Tracy, and then Paul, and then I'm going to bring us to an end.
So kind of in the wake of everything that's happening in the Met that's impacting on the whole police service, complaints have been looked at, and I think the kind of key thing for us is not being defensive, actually being open, transparent, putting names to names, putting the hands up and saying, yes, a mistake was made. There is learning to be had. This is the learning. This is how we're sharing it. So in West Mercia specifically, we do a lot of what we call kind of 60-second learning. So we send out like an infographic sheet that says, this is a situation that was handled poorly. This is what should have happened. This is what could have made it better. And in terms of giving that feedback to the complainant and actually empowering them by telling them what has changed as a result of their complaint, that has kind of improved our satisfaction levels in terms of complaints. Obviously, in the policing world, very often the complaints are never ever going to kind of resolve as such in that person being satisfied. But at least if they see that, what we'd call procedural justice, the process, the whys and the wherefores, then it kind of provides that reassurance and starts to rebuild that confidence and trust.
That's really helpful, actually, and so thank you for that. And I agree with Nigel in terms of getting our teams together to look at this and work through it jointly. But I really like the idea of the 60-second improvement piece in terms of quick response bit. So when we do that, I like Matt, Tracy, and Asper, whoever it is that's leading out on that, to actually come and show how that works and how you use that, because I think the bits that we can probably take from that in terms of some learning from that. Paula, then I'm going to bring us to an end and go through what the ask is of the board.
Thank you. I just wanted to pick up on the point about the links with bereavement provision. We have Gordon Koshian, who's a consultant in public health, who's coming on later to talk about vaping, but he has the public mental health agenda in his portfolio. He's done quite a lot of work around bereavement services, working with ICB colleagues, but I'm not sure they've made that link between complaints and bereavement provision. So I'm quite happy to take that as an action to discuss that with Gordon after the board today. And just for anyone that may want to know what support is available, you can contact the council's first point of care team, contact team, and they will talk you through all age resources and support available for people around bereavement as well. Thanks.
Thank you for that. So Lynn, thank you for the report. Thank you for presenting it and pulling out the main themes in terms of that. I think that good conversation in terms of where that's at, but with myself and Nigel, and then I think we need to just pick up with the complaints teams and the patient experience teams in terms of the action of, right, how do we get people together across the system to have the conversation, and I'll flag that to my chief nurse in terms of that. So if you could pick that up as well, Nigel, that would be appreciated, and PFT colleagues could do that as well, that would be helpful, and so we'll take that forward from that side of things. I think the presentation then in terms of how do we learn from that and how do we demonstrate our improvement from that clearly will play through in terms of that. So then the board are asked to approve taking forward the recommendations that are set out as 1, 2, 3 and 4, which is adding public information to the website about complaints, people's rights, is about all organisations committing to working in partnership to meet the expectations laid out in the NHS complaint standards. Of course, you talked about social care as well, but your recommendation is just about the NHS complaint standards.
No, like I say, the process is the same for social care as well.
So it's NHS and social care complaints. Involving people who've used complaints process to develop an integrated system across the ICS, so the user experience element, and then public report on the complaints received, the learning and the actions taken to prevent similar experiences. So is the board happy to support those recommendations being taken forward and shared with partner organisations to progress? Nigel?
If I may, it might be useful, certainly on that last action recommendation, to also just consider how that's already done at different partner trust boards.
Yeah.
And there might be other mechanisms there that we can just make sure that we don't replicate, but we can link to.
I guess what I was assuming in there, Nigel, was rather than saying something has to be different, if we can demonstrate it's already happened, then that gets picked up. It wasn't you must do something different in response to it.
Yeah, I think it's about making the public aware of where that information is as well, because there is information out there.
Okay, good. Any final comments or thoughts on that? I'm going to move us on if that's okay. Thank you for that. Lynn, good comment. Okay, strategic housing report. Laura and Paula, who am I coming to?
Myself.
Not at all. Laura, over to you.
Good morning, all. So yeah, thanks so much for allowing us to bring this paper to the Health and Wellbeing Board today. As Chair said at the beginning, I'm going to assume everybody's read the report, so I'm not going to go through it section to section. We've recently presented at the SHIP board, and we've also done some work with the council scrutiny meeting. So this feels like an obvious next step, really, in regard to bringing a housing policy forward. I think we can all agree around the table that housing is the foundation of good health. If you don't have stable, secure and suitable housing, then you cannot look after your health and wellbeing. So the two are intrinsically linked. The report specifically highlights the importance of housing in supporting and improving the health of the population. So it updates the board on key areas of work, current activity undertaken by the council strategic housing function, as well as looking at some of the frontline work that's ongoing at present to improve people's health and wellbeing. Housing is an important determinant of health because substandard housing is a cause of health inequalities. Ensuring people have good housing can help to delay or reduce a person's need for health and care services in the future. Secure, stable and suitable housing can help people to retain their independence, health and wellbeing for longer. And it's estimated that the cost of poor housing to the NHS is approximately 1.4 billion per year. So we do recognise that there's a huge amount of work already taking place around housing and links with health, but we do believe that there is more that can be done. The report asks how the system can better integrate housing within its decision-making, strategic commissioning and delivery programmes. To explore these opportunities, we would like to set up a workshop and bring together health, social care and housing officers jointly to develop closer working relations. The workshop would allow the system to work through how to maximise housing and health links across the full prevention, treatment and recovery pathways, and to build on and extend further the good practice that is happening. So the report requests endorsement from the board to set up a workshop with system colleagues. We also aim to look at how we can improve working relationships and processes, and we then want to bring a return paper back to the board in approximately 6 months' time, where we will be able to demonstrate the positive changes through examples of case studies. Thank you very much.
Thank you. This is I'm sure there's a more technical phrase I could use, but you know what? So because it gets us into the Marmot principle piece, doesn't it? And gets us into what are we doing in our communities and what does this look like and how do we tackle some of this in a different way. And speaking not just as the chair here, but if I speak from the NHS perspective, then I agree entirely with you. The difference we can make often from an NHS perspective is small at the end because it's reactive and responsive to when things individuals' health is not well, rather than what is our contribution differently in a different place. So I've got a number of thoughts around this. I mean, my view really simply when we talk about integration, we talk about integrated care, is really what we're trying to do is how do we give individuals decent education, a home, a job and a friend. And if we can tick all of those boxes, then in the main, people will have an opportunity to make good choices and make good decisions, and their health and well-being is likely to be better, which means their requirement on health service, which means everybody wins in that space. And that comes the same when we look at antisocial behaviour, when we look at crime, when we look at different areas. You can come back to some simple principles, and I recognise I'm sitting next to public health expertise as I'm trying to talk about Marmot in this space, but she's not kicked me just yet, so I'll keep going on this. So the Health and Wellbeing Board talking about housing is really important in that space, which is why I said this is my early comment on this would be I support the workshop piece, and I wonder whether that needs to be done with the place board. And so we land it in place, so we start talking about the place agenda in a different way, because the resource that the council can bring around housing and affordable housing and improving housing is really significant. And at that point, the NHS needs to be a good partner. It can't lead on this, but it needs to be alongside. So I wonder whether that needs to happen in the place space, where we get the partners in there and talk about that potentially. But I'll pause for a second there before I get too excited talking about that.
That's quite understandable.
So So a couple of points from me. Really helpfully, the Place Partnership is this afternoon. I've been asked to chair it today, so I will absolutely pick that up as part of the board later on. And Penny will nudge me and remind me, so we can cover that one off. And I guess there's something for me about for that workshop to really think about the whole pathway. We were talking with the three of us about there's masses of opportunities in that prevention space. There's a big link for me with this housing report, with the early intervention prevention framework report that's coming up shortly. But there's some real practical things that I think if we all start thinking housing and we have that in our minds, so when the child keeps being admitted to hospital for respiratory issues, that the clinicians are thinking about, actually, is there a housing issue here? Is this child living in a home that's got lots of mould? When we could work with Laura's team around the affordable warmth response, and so it's having those prompts in people's minds and using that workshop to really get those high up in everybody's minds. So we've all constantly, we're not just thinking prevention, inequalities, we're also thinking housing. And I think that's our kind of the three of us, that's our collective push to the system to get that up on our agenda.
And I think some of that then is when you have are the patients reoccurring in emergency departments, how much of that is housing, how much of that is behaviour, where does that play out? But it's also then, so what? Because the challenge in a busy ED or in a busy GP surgery is I just treat what's in front of me in the right way, because that's the job and that's the right thing. But then it's how do we make it easy in terms of saying, well, what might some of the wider considerations be, and how do we explore that and get into that space? Because I think that's often the some really clear case studies, international case studies that demonstrate the biggest difference was, one of the American ones is they went into a set of flats where there was continual respiratory conditions, and they changed the air conditioning, and the air conditioning solved the problem, not the medication at the hospital in terms of treating the respiratory conditions. And we'll have similar examples: mold, heat, warmth, everything that goes with that. Rachel, you're desperate to come in.
Well, and I think everybody's put this much more eloquently than I would put it, but I mean, absolutely, we welcome this report here, and I think your point around actually where we bring in education and employment and others is absolutely critical space for us to be getting into. I think, as you said, housing we know is absolutely fundamental, and not just to our residents. Also, I was thinking our workforce in the state, and we've had conversations around key worker housing, how we retain people in Shropshire. So I think there's a real strong element around this. We had started to talk about through the ICB work, but I think this gives us the workshop. I would really support it. Would give an opportunity to be a catalyst around this. I think there's, as you said, Paul, there's strategic point and there's the actual practical what we can do. So we need to encourage people to think in that space. I think there's also, as you said, there's the kind of prevention and through to the kind of support end, and we've seen examples of that even over this weekend where we've kind of been in the kind of reactive space, but also we can do a lot preventively. I think to your point, and Jackie will probably want to come in around the cost of living. This is something we really were talking about last year. There is a real opportunity practically when people, for example, turn up at ED, doctors, surgeries, others, where we can signpost people. We've got all of the cost of living support. We've got things we can do, adaptations we can make. We could probably do some work, and we've asked, can we get into the data space to predict some of this? Yes, we can. We know, and we know that we've got poor housing stock, particularly in Shropshire. I think your point about place and the rural stock is really impacting on people's, and so we've got a job to lead this strategically, but also there's some real practical things we can put in there. So I think I'd really support the workshop. I think there's a huge amount we are doing, and there is opportunities now that we can join up both proactively and kind of when people appear. But I'll probably let Jackie pick some of that much more than I can, but really welcome this and think it's a space we absolutely need to get into.
Jackie?
Yeah, I'll just agree with Rachel as always, and you know me, VCSA's there all the way for this. It's really important, and yeah, anything, please involve us in the workshop. Really,
Nigel, and then Councillor Molly.
It was just a quick support, really, and especially if you're afraid of Rachel, then I'll be as well. I would agree. It's such a vital area, and I was just thinking as Simon and Rachel were talking that there is work that collectively we're doing under a population management health group, as well as looking at prevention and health inequalities, and that is actually a good group already, a set of groups. We've got both Rachel and counterpart Liz from Telford Wrekin Council involved in that. And I'm conscious that as a system whilst we've got the two local authorities, we have got one main acute trust, one mental health trust, one community trust, and therefore there's real opportunity in making sure that where there are parallels and things that we can do in a similar way, we do that. But absolutely, I would support that working place. I also absolutely support that point that Rachel made around the workforce side. There is work that is being done as a system to look at both the future training, retaining, and also reforming how we do stuff. A huge amount of work has gone on to look at bolstering our staff, including those recruited from overseas and overseas trained individuals who are making a super support. But they will also need that support, and we've seen the changing nature of our populations in that way as well. So I think there's some smashing aspects to bring together, but I would include workforce.
Thanks, Nigel. I'll bring Councillor Motley, then I'll bring Ben in on Teams.
Thank you. I'm looking at this from the rural perspective. Fuel poverty is a really big issue in the rural areas, and it's very often private rented housing, which actually is the worst. But there's also this thing about trying to break down the silos here, isn't there? Because actually, if we had a lot of cumulative eyes and ears, alert when you go into a house, you may have gone in to look at a newborn baby, or you may have gone in, as a district nurse, or something like that. But actually, if you go in and you find that living conditions are really poor, then it's not, you don't just go out again. This is something that has to be brought to the attention of people who can do something about it. And it's that thing that we're terribly bad at, isn't it? Which is actually really thinking and working holistically. And if we could improve that, I think we would make such a difference to people. And actually, at the end of the day, I think we find ourselves cutting costs as well.
Agree on time, Councillor. And I think that's a bit into the workshop. The workshop is how do we generate tangible actions, not just do the let's talk about it, which I know is what you'll focus on. Ben, on Teams?
Just thanks for the report. Some really good points made all round. And I suppose just to reiterate from a mental health perspective, housing is both poor housing, a symptom and a cause of people with severe mental illness. It's something we really wrestle with. It's been a factor in the sort of mental health transformation. There has been some work done. I just wanted to kind of highlight that really, and if those conversations have been had or not, I don't know. But there's people within the trust who have been working on sort of secure housing for people with severe mental illness and tenancy failures and that sort of thing. So we'd be really happy to contribute to that workshop. And if you need points of contact, then please do get in touch, because we know this is really core aspect of maintaining people's wellness. So thank you.
Really helpful. Thanks for that. Penny?
Thanks. Just very quickly to say that the place-based joint strategic needs assessment is demonstrating where in Shropshire the particular issues are. So it is in some places more housing is more of an issue than others. So we've got something really great to base our work on and a starting point around that, and we can bring that into the workshop. And then also just to say, I know that when we worked with staff last year around, and continue to around social prescribing, and we went into the hospital and we talked to clinicians about social prescribing and what would really help, and clinicians were really up for that connection between home and the hospital, and how at times, they would be under serious pressure to move people home, but then realize home had no heating or home had no, nothing for people. So it was really a really key issue. So I'm really pleased with this, and I think there's more we can do by working together.
Okay, I can't see any other hands or comments. So we've got a great paper, great conversation. I think there's a couple of bits that fall out of this in addition to the recommendations. I was just leaning across to Rachel and saying this feels like with the Marmot principle bit, integrated care partnership space, so across the entirety of the system, but let's not lose the tangible actions in terms of what difference we can make locally now. So I think we'll pick that up outside and think about what a wider ICP workshop might be and some of the Marmot principles and wider health inequality piece. I think the place aspect, and Paul, giving your sharing this afternoon, then that's really helpful. immediate line of sight. Always better when you can tick your action off straight away on the same day. So that's good. And I think the piece around linking it with some of the antisocial behaviour piece and crime and looking at that on a place-based GSNA, so that we start to pull some of those strands together. I think it's not just a local authority and health, it's a genuine public sector across the board piece when we get into that workshop space around looking at all of those opportunities. And on that basis, I'm asking then the board to accept the recommendations, note the contents of the report, done and discussed in some detail, recognise the opportunities raised within the report, and discuss how the system can better integrate housing within its decision-making, strategic commissioning and delivery programmes. I think we've got a strong commitment around that. Endorse the workshop with system colleagues. I think we talked about what does that place, what does it look like, and then ICP wise. So I think we've developed that and said yes to that, and to agree a return paper in 6 months' time to update the work undertaken, local case studies, improved working relationships, and the bit I'd be really keen on that, and I think it's implicit, is and the impact. And doesn't say it. I think that's what you would always want to do with a case study anyway, but it's that impact piece, isn't it, in terms of where we've made that difference. And then I'm also aware it will be 2025 really quickly, which is when the council's housing strategy comes back round. So the work to develop that, because it's 2020 through to 2025 was the Shropshire housing strategy. So the work I would have thought during 24 to prepare for that, based on some of this work, is going to be really key, because I'd be really keen for the Health and Wellbeing Board to play a strong role in helping shape the housing strategy that gets refreshed in 25. Laura, Paula, does that give you what you'd hoped for from this one?
I'm really still going on fab.
I could have stopped at that. Good, thank you for that. Thank you, everybody. Great conversation and discussion, and look forward to the outcome of the work that goes with that. Okay, so moving on in terms of the agenda. Citizen Advice Shropshire report, when the safety net fails. Jackie.
Screen slightly. Oh, there we go. Okay. Well, thank you. It's nice to be able to take off my VCSA rep hat and talk about the work that we do. But certainly I can't take credit for this report. And I'd just like to thank Alexandra, our research and campaign officer within Citizen Advice Shropshire, and Sophie Paget, who's now moved on to the Trussell Trust from the Shropshire Food Poverty Alliance, for the work they did on this report, and also to Helen Brown, who's our new coordinator for the Shropshire Food Poverty Alliance, on the updated work that they've done on food baskets, unclaimed benefits and issues facing food banks, which I'll kind of talk to now. So yeah, I just want to say credit to them, not me. But I also think there's credit to the system as well, because when you go to the recommendations, some of you will be going, "Oh, we've done this and we've done that," and I do think that this report and the journey it's been on shows how partnership working can make such a difference with no money or very little resource. And so credit to the system as well, even though there's still places where we have to go on that. So on the report, is it going to move on? Did you use your arrows in light? That's one. Let's try. That can open now. Move the. Because Jared's got it. Is it very to like it? Is it? Yeah. I don't know where it's disappeared to. So try this back onto the screen. It's one of the IT skills fails. No, you're gonna. I'm sorry. Oh, never mind.
Can I take control, Jackie, for you?
Yes, please, if you don't mind. Oh.
There we go.
Right. So I probably should have dipped in there a bit sooner. Just a bit more assertive next time.
That was the most understated, just like I've just taken it. And the slide moves on. It's fantastic.
Oh, there we are. Look
Yes.
at that.
Another fabric.
You come back to work with me? I'm sure. That's my effective
this afternoon.
Next slide then, please. Thank you. So over, I know you can't see that, but the lines of the way the lines are going are the important bit. So this report, the research that we did for this report was through the winter of 22-23. And we surveyed people in Shropshire to find out how they were coping with the cost of living crisis, but also looked at the barriers they faced to access the support that was available for people who were struggling. When I talk about the safety net, what we're talking about specifically are the systems of government programmes that are designed to provide a basic level of support to people facing financial hardship. So that's things, welfare benefits, universal credit, personal independence payments, but also the local grants and the local benefits that are here within Shropshire that are under the control and responsibility of the council. So that's like council tax support, discretionary housing payments, and the response we had to the cost of living through the hardship and support fund as well. So whilst the research was done in the winter of last winter, I think it's really relevant now as we're heading into a second winter with a cost of living crisis still there. And I know there's been positive news reports this morning about inflation's going down, but the figures and the stories behind that are still frightening, and food prices aren't going down, they're staying where they are, along with utility costs, and rents are increasing. So I just want to, on those slides there, you'll see the top one in the top right hand corner are the number of people coming to the Citizens Advice Service in crisis. And so you can see it's just gone up and up and up and up. And in this coming into this winter, people are still coming to us with issues around crisis. That's referrals to food banks and referrals to local support as well. And then the bottom graph there is just how the demographics of those people coming in crisis are changing. So the bottom line is people with long-term conditions and disabilities, and the yellow, the orange line there is people who don't have that. And you can see that coming up to halfway through this year, people coming in crisis have gone are higher now than those that without a disability or long-term health condition. So the figures on the right-hand side there are the demographics of the people that we are seeing helping people within food banks in the north and the south of the county. And 70% of those people that we're seeing and giving advice following a food bank voucher have a long-term health condition and a disability. So next slide, please, as well. So what we're seeing is what's impacting on that still, not just in the winter. So appreciate, but housing tenure, we're seeing now a big drop in people in negative budgets who have a mortgage, social housing and private tenancy there. And I'll just say one thing about local housing allowance rates in Shropshire haven't moved for several years, and so as rents are going up and people are lower income, the housing benefit or the housing cost in universal credit aren't covering the whole of the rent. So more and more of people's essential bills are going out, meaning they've got less to spend on things like food. So that's what's impacting on people in crisis at the minute. And turning up at food banks is their utility bills, their housing costs, and just that their money isn't going as far. So basically, this report's as relevant going into this winter, in fact, if not worse. More than half of the people we support who have debts like utility debts and council tax support, that's what our biggest creditor is Shropshire Council, are in deficit budgets, not because their expenditures it's those bills, as I said. So next slide, please. And I just think as a health and wellbeing board, it resonates with the conversations we have. It's important that you understand what poverty means in Shropshire today. And the people we spoke to told us how they have to make choices tough choices where they're money every day, all day, with no room for errors. The balancing act was often impossible, and it was common for people to have gone without essentials such as adequate shelter and food. So what did we learn from this? And I'll go through it quickly. The system's difficult to navigate. It is so complicated. And when we talk about kind of bereavement and signposting, who do you go to? Where do you go to? When it comes to welfare benefits and costs, some of it's the council, some of it's the DWP, some of it's somewhere else. And it is just really difficult. And one of the things following from our research we did last winter was a cost of living training. 600 people came to that. It was online. It went onto YouTube. It was really important, and it helped those people supporting people at the grass level to know where to signpost. And again, like MEA, when we're talking about cold homes, where do you get support? Manchester Energy Agency, absolutely fantastic, and all our partners within the system joined that training. So we're repeating it again coming into this winter. I think the cost of living work that we've done with the council's been really great, and having it all on one page, even if it's the council, you know, my web page, having it in one place where all the resources there where you can direct people to and can collate that has been really, really important, and especially going into this winter as well. But next page, I think this was the biggest barrier that people faced getting support from the cost of living, and that's stigma. There's still a misconception about people facing food poverty, that they're there because of bad decisions, not being able to budget, not being able to cook. And this, you know, and when you go on to the next slide, this is just the words from the interviews. People feel embarrassed and feel ashamed. And when I've been presenting this report, I've been coming on the back of the healthy weight strategies. I've been coming off, you know, the same kind of route. And I've still been with people saying, well, it's not expensive to have a healthy diet. And, you know, healthy food isn't expensive, but it is. And when you're watching your prepayment meter to put your oven on and you can see it going down and down, cooking isn't an option. It's not that people can't budget, and it's not that they don't know how to cook. And I think the stigma is, we've done a lot around producing videos with the social task force about addressing stigma, but I'm still an upward battle, and we're still having that, and people are embarrassed, too embarrassed to ask for help. And I think, you know, we're still having conversations with the system about when you're going asking for crisis support, and there's an argument about what sanitary towels that you're using, that they're too expensive and you should use something. We shouldn't be having those discussions still. So next slide, please. Not having access early on, we talk about a lot of prevention, and it's really great that in Shropshire we talk about prevention, and I'll not say any more about that. It's clearly that the cost to the system further down is so much more if you've got if people aren't eating, if they're not in good warm homes, the cost is to the system further down. Again, the fourth one was that understanding there's a poverty premium of living in Shropshire. Again, we all know half the wards in Shropshire are rural, and people very much felt that the rurality impacted on the cost of living for them. So if you haven't got transport, and we've brought the Shaping Places information on the food baskets, where £19 for one basket in Ludlow cost £48 in Clun, and that we've updated that exercise as well. And it's really interesting that where you think the value for money is within those cheaper supermarkets, it's their costs that have gone up more, and things like the co-op are the most expensive. Then the next slide, please. About national safety net, and just understanding that nationally decisions made their impact on us locally, and I think we are heading forward towards managed migration in the early 2024, just at the time when people are going to be getting their high utility bills to pay. There are thousands of people in Shropshire that will be moving on to universal credit, and they will be asked and invited to apply. They won't go on automatically, and people will miss out. So this is an exercise that we've done. So we're talking about the cost of living. People can't afford their bills, they can't afford food, and yet there's still millions of pounds of unclaimed benefits in Shropshire every year. So 24 million pounds of universal credit. I think the 8 million pension credit is a worry. Housing benefit, council tax support, child benefit, free school meals, and I've got a comment to make about free school meals in a minute. But the Healthy Start vouchers, you know, when we do publicity around that, it goes, the number of people who claim it go up, but it's still massively underclaimed, and they're really important vouchers there for pregnant women and for families with young children. So we still got a lot of work to do, and I know the Social Task Force and the cost of living themes is about maximising income for people going into the winter to make sure that they've got, because deficit budgets, people can't afford food, and they're still not claiming everything that they should have. So I just want to talk very quickly about just how food banks are on incredible strain, and why we're heading towards another winter of concern. The rising cost of food creates a 22 situation for food banks, because it drives up demand but also drives down contributions to the food banks. So both Shrewsbury and Bridgenorth food banks are spending about £1,000 a week to provide food support for people from the bank. Oswestry is on course to spend £30,000 in 2023, and that's up from 18,000 the year before, and 7,000 in 2021, an increase of over 300% in the demand coming to the food banks. And certainly the smaller food banks in Shropshire, of which there are 15 food banks in Shropshire, Church Stretton Food Bank is spending £500 a week to meet its demands, and Bishop's Castle £800 a month. And we've got the case with Gabowen Food Bank that's likely to close very soon because of lack of demand and funds there, and they're supporting regularly 22 families. So yeah, don't want to be a doom merchant, but I just want to say that this report, whilst done in the winter, still has relevance going into this winter. And next slide, please. So there were a number, they're the number of households as well that are affected by benefit caps. When I'm not talking about a few hundred families and households here, are big numbers. And next slide, please. Yeah, that's the real cost of living. So if you go through some more, it's just basically to go to the recommendations, of which there are 4. So if you go back one page, that's it. So they're the recommendations. Now, underneath that on the report that's gone to you all, there's a number of smaller bullet points. And I just want to recognise the fact that our partnership working in the county is wonderful. I think you should be very proud of the Social Task Force and your leader in Rachel in that. It achieves a lot with no money. It's experts coming together who know what's happening on the ground, sharing information, looking at where the gaps are. And from that, we've had a number of great initiatives, the cost of living response, as well as the digital exclusion network that's come out from that as well. And we're talking about housing and strategy and all of that, and it's gone really, really well. And support system design. I think local services should be designed to protect people's dignity and help individuals to come forwards from support. If you know you're going to have an argument over, the very basics of what you need, and if a money advice agency, not just Citizens Advice, says this is the budget, they're in a deficit budget, you shouldn't be then going away and looking through their bank accounts to see what bad decisions they've made. Oh, you've been to Greg's twice this week. Well, if you haven't got an oven that works, how are you going to get a warm meal? I mean, there's lots of that, but the system is designed to catch fraudsters and people that make bad decisions. It isn't about encouraging people who need that help to get that support. And we still need that, and we're still waiting for kind of an easy application process into the Household Support Fund on the website. So I've gone on. So what do we need to do now from those recommendations? I would ask the Health and Wellbeing Board to support the high level recommendations, and I just want to recognise the fact that yes, you do recognise the voluntary sector. It's wonderful, and I think we had a great event, but there's still things to be done. So we need health representatives on the social task force. Health is really missing from that. We need to keep promoting the comms team and the work that's been done there around the cost of living training and roll that out across the system. Why we haven't got automatic enrolment for school meals in Shropshire, I don't know. Other counties do. There's no reason why we shouldn't have it. And we were nearly there, and then it got pulled back. Again, local services should be designed to protect people's dignity, and they should know how they can apply, what the criteria is, and how they'll be treated. I think training for local councils on the cost of living, and anybody that's there supporting people at crisis should have that cost of living, and we should make that resource there. But thank you for all the work you've done. I'm sorry I've rabbited on, and but yeah, that's my report.
So Jackie, a lot in that, and really insightful and helpful in terms of setting the context and setting the challenge. I mean, I guess my starting point is my concern is more for this winter than last winter, if I'm being honest, because it felt as though last winter there was a public outcry in terms of the challenges that were there, and there appeared to be much more public awareness and support in place. And this year it feels as though because somebody's saying inflation's coming down, that's it, then things are better. And I'm significantly more concerned about this winter than was last year, both in terms of then what that means for individuals and decisions taken, but then what the impact of that will be in terms of public sector demand that goes around that. So anything that we can do to support local people to get to a better place in this, I think, is absolutely paramount. So so Councillor, on Teams, I'm going to Kirsty.
Sorry, Jackie, let's pick up that conversation about school meals outside of this meeting. I'll drop you an email now. I think that's some really good points. Is that okay? Excuse me, I've got a snoring dog. The other thing is, I know we did it before, didn't we, Rachel, with Steve Compton with the digital newsletters? We put the links so all schools get a digital newsletter from Steve, and that worked really well, you know, talking about stigma. But, you know, if you've just got a link in a school letter and a school website and educational providers, I think we can redo that. We did that before and that worked really well. So, Jackie, that's my promise to you. Let's get that done again. And when you look at those figures, 6 million and 1 million, let's see what we can do. So I'll drop you an email now and we'll pick up that conversation. Thank you.
So I was going to ask, so Claire, could we pick up and Claire and Nigel, the social task force and the health representation piece, please? So we'll take that off as well. Rachel?
Yeah, so I mean, I think this report is a really difficult report to read, and that's absolutely right. And I think, as you said, this winter is going to be much harder than the last winter, and none of this is going to be the support. You know, the signposts and the services are still there, but I think we could use this as a platform. We are pushing, and there's lots of comms going out, but let's use this as a platform to say to the public there is support, and it's really simple. Google cost of living in Shropshire and you get straight to all of that signpost information. Our outreach work is signposting people, so we've got people out on the ground. And actually a really good example of partnership working where we're starting to join some of that up. So the Winter Well around which service to choose, we've absolutely said people may not at the moment feel they need to use A&E, or they won't be at that point because it won't be exact. We can get to people earlier, and some of those messages again, we just, every single opportunity we use, we're thinking as much as we can we get those in. But I think using this as an opportunity to get all partners and all frontline staff to think, actually there's support there. Can we signpost people, raise an awareness that people aren't, and that people could be accessing some of these benefits? So maxing all that out is part of the work. So I think using that as an opportunity, but I think you're play, Jackie, around staff. We've got the training, there's the video already there, but can we make sure that people just know it's the support there and don't feel, often feel, I don't know what support I can offer people. Well, we've got some signposts in there. It's so difficult. It's such a difficult situation in Shropshire, and we've talked about housing already. We've talked about what's coming out through the JSN. We know this. It's actually the cost of living is in a rural area like Shropshire, with the transport, with the housing pressures, with the low wage economy, it's an absolute melting pot. So we absolutely recognise this. It isn't going to go away this winter or next winter. The report is a really difficult read, and we have to accept that. But I think together we've got a lot more to do. We've done a lot of good work, but so I think it's asking every organisation to go away and as collectively, how can we continue to build on that, both those messages for our staff, but also for the public. And I think the point around dignity and stigma is really, really important. Some really difficult things to listen to in that. Thinking, as you've said, the sort of misconceptions that we just need to keep busting. That will take time, but again, that's one of the things that we said we would do as a board. So I guess it was just a thanks for bringing the report, to recognise that there is a lot being done and continues to be done, and it feels like we're starting to get there, but this is a really difficult point, so we could use this as a platform, I think, to push some of those messages out, to say this and to galvanise that support again going forward. And it cuts across. I mean, the links everywhere off there, you can see how integration supports this, because our frontline staff can sign, how we can signpost our prevention agenda, the housing we've just talked about. And it's for us to keep knitting that together. So it was just a huge thanks, but a plea as well that we keep pushing those messages.
Just very quick, can I just add something?
Fine, Councillor.
Well, thank you very much. Yeah, just thinking about last year, one of the things that really went down well in the rural areas was the warm welcome. And I think it's a really good idea to start promoting that again, because they did respond awfully well. A lot of these rural areas, they're sparsely populated, but they have a very strong sense of community. And as a result of that, they actually know who's in distress, they know who's in trouble. And if they feel that they've got the impetus behind, and if they feel that they're not intruding on people, they're very happy to try and give people a hand. So maybe we need to talk about how we can kind of fashion that a bit. But I really do think that there is so much potential in the rural areas for everybody to help everybody else in a way which potentially doesn't really happen in the towns, because it's all about, sparse areas and how you cope in a sparse area, and, who needs what. So maybe, Rachel, can have a little chat about that.
If I can just say two things, I do ramble, I'm sorry. There's so much in my head to do with food and people in crisis things, but there's been two things that we've said through this, is you've got to have a cash first process. Grants, white goods don't go to the heart of the matter. People need money to pay their bills and to buy the food that they need. And that's one thing that Shropshire Council has done. And we have to recognise that through the household support grant, the majority of that was cash that went straight into people's pocket for what they did. And also that when we talk about warm welcome, during the day, which is when they're mostly there, and for people for older people, which is really important, but the people that are really struggling with the cost of living crisis are people who are self-employed, people who are working during the day and actually going home to cold rooms, because actually you can be working and still not be able to pay your bills. So there's that kind of thing. So the approach through the household support fund about giving money is really important. And also the fact that, transparency wise, the council's been really upfront about the decision making they've made around that money and how it's spent, and has worked with the hardship and poverty group, which is part of the social task force, to say, does this resonate right? And does it do? And you should applaud that. I know there's difficult conversations, but, Shropshire Council, as part of the system, has worked really well, and it, again, encourage all the partners to get on board with that.
Laura, bring us to an end on this agenda item.
Yeah, just very quickly, and again, thanks, Jackie. It's really important, and I'm hearing it more and more and more in terms of some of the complexities of the individuals that we're dealing with on a daily basis. So absolutely fundamental. I think it'd be useful just to have a look at maybe what pulling together a bit of a comms plan actually around it, unless that's already been done, because actually there's a whole raft of individuals that we can really target. And I'm thinking from my end, I suppose, particularly the provider market, where you've got the workforce who probably are part of that low cost wage, you know, who will need that support, but they're also going into people's homes who are also vulnerable. So it's about cascading that information on a wider footprint. So I'm happy to do whatever you need from my perspective to do that, but unless it's already being done. But I can see Rachel kind of nodding as if saying she's got it.
It's great, and we're putting it together. But for health colleagues to be part of that, we did talk at the beginning of the winter about doing that training for health staff, and it just fell through. We've put a toolkit, a bit of a plug here for people are over here on skilled worker visas. You'll have seen in the press as well about kind of modern slavery and just some of the awful cases in Shropshire happening with domiciliary care workers, and we put toolkits together for that, put a toolkit together for people who are self-employed if they're facing debt and low income as well. So and we wanted to present that, so I think there's a lot we can do with the workforce as well.
Okay, I'm going to bring us on. That's okay. We'll run over on this agenda.
Laura, I'll connect with you at another meeting.
Which I was comfortable to allow that to run because actually really important conversation. I guess the challenge for all of us is around this table, speaking to the converted. And our challenge and our responsibility sitting around this table is as leaders is how do we take that back into our own organisation, our own networks, and devolve that and share that and continue to talk about it. Your passion shines through, Jackie, as ever, so thank you for bringing that to the board. I don't think anybody's going to go against any of the recommendations in terms of supporting partnership working, supporting system design to work around people and communities, recognition of the value of the local voluntary sector, and advocating for big picture change. I think those will be a yes, yes and yes. What I'm keen about here, and what I've heard actually, whether it be Laura, Penny, others, is that Rachel is the commitment to, and Kirsty online, the commitment to the actions that follow as a result of this. So let's make sure we deliver on those actions and hold us to account if we don't deliver on those actions in terms of that space as well. So thank you for that. Okay, I'm going to move us on then, if that's okay. So we are slightly behind, but not massively behind. And of course, now we get to the reports that are predominantly for information with discussion by exception rather than long conversations. So, if your colleagues will remember, we try and now structure the agenda so that we have 2 or 3 big agenda items where we spend longer talking about them, and actually complaints, strategic housing, and then when the safety net fails in terms of that feel like the right really chunky things to have had our conversations about. The agenda now is more around the reports have been received, and it's how do we move through them at some pace. That's a subtle hint to presenters for the rest of these agenda items in terms of that perspective. So, okay, I'm going to move us on then. So, ICS update, Claire, welcome. The paper is there, the report's there, it came as a separate report, so apologies it wasn't in the back, but any headlines from it really quickly, Claire?
Thank you, Simon. I can be really quick with this because I think it's a fairly factual report. I think there's 2 things I'd like to just pull out of it. One is around the GP Access Recovery Plan, and actually the plans have been returned to the ICB for overview, and I think it would be good at our next Health and Wellbeing Board meeting to bring that back about what the plans look like, some changes. So I'd recommend that. And then the other part I was just going to pull out was probably more related to Rachel around the child mortality slide. And I didn't know if you would take us a little bit through that, Rachel, if that's okay.
I think so, thank you. So there is a slide in the past. I think it's just important to highlight. At the last ICB board, there was a report around mortality more generally, and one of the areas within that, which is obviously a concern, and we wanted to look at more information, one was around the child mortality, both infant mortality as well as child mortality. There was a discussion at the development session, the ICB development session, where we felt very strongly that we looked at all of the data and intelligence and evidence that we have around child mortality at a high level, and felt that there's a lot of actions and work that's taking place, but what we need to do is come together as a system to look at our system response, because absolutely every single child death is a tragedy, and we absolutely make sure that we've got all of the actions, that we're working collectively as a system, that we understand the evidence base and what's happening in Shropshire, and that we've got a collective system-wide action plan that considers there was all of the evidence from those modifiable factors and looks at all of that together collectively. So there is a commitment, and a workshop will take place with partners in December. We're looking at to bring all those kind of key stakeholders together and move that forward. And we would expect a report to be brought back through to the RCB as well as obviously the Health and Wellbeing Board. We want to have sight of that as well, and we'll be asking members to be involved in that and bring that forward, and I'll include all the partners. So I think it's just important to recognise that we've seen that there's already work going on around that, but there'll be that collective workshop at system-wide action plan as an output and result of that.
Thank you, Rachel. Nothing else on that? Nigel?
Two quick things, if I may, Chair. I think the first one is just perhaps building on what Rachel has just described, and we've just been talking about another couple of examples, perhaps in the housing or others. I think it's just an illustration of how a willingness to work across a range of different partner organisations, and whether that's public sector or other sectors as well, is really, really valuable. This is a complex area, and we need everyone involved in that for all the right reasons. So I'm really grateful for that. I think the other bits are the update does include a range of challenges, and probably just with my SAF hat on, just obviously with some of the pressures. I'm really pleased that that the work on reducing elective waiting times has continued on track. We know that it's really, really important for primary care because of the volume of people that are sitting on waiting lists. And the cancer, actually the updated month shows us we're now ahead of plan and ahead of trajectory in terms of it's better than rather than behind. I think the only other bit was just to reference that obviously we will continue to work through the Joint Health Overview and Scrutiny Committee on key areas, both as a system and obviously individual organisations. Thank you.
Thank you. Thank you. Any other comments or questions on the slide pack that was included as an update? Oh, thank you. Okay, I'm going to move us on then, and we're moving on to the smoking cessation, including vaping. Gordon, I can see you online, so we're coming across to you if that's okay.
That's great, thanks, and hi everyone. First of all, apologies if I'm looking quite colourful. My heating's not working at home, and this is the thickest jumper I have. But to move on to the paper, so as you can see from the information, it's an overview of the Stopping the Start plan to create a smoke-free generation policy paper, and the papers include an overview of all of the proposals, but in a nutshell, it builds upon the smoke-free objective to achieve by 2030, to create a smoke-free generation and to reduce youth vaping. The plan, as it states in the information, is to phase out the sale of cigarettes for anyone born after 2009, to have additional investment for local areas to invest in smoking cessation programmes, additional measures to address youth vaping, and to strengthen the enforcement to allow all of this work to occur as well. So there is a consultation open by DHSC on these proposals, which is open by the 6th of January. Our proposal within the paper has been to have our underage vaping task and finish group to collate responses on behalf of Shropshire Council to respond to that consultation. Now, the reason for this suggestion is many of the members of that group have a vested interest in smoking cessation and tobacco dependency, in addition to vaping. However, we recognise there is still opportunity for individuals to respond to that consultation themselves, and of course encourage organisations and partner organisations to the Health and Wellbeing Board to also contribute. Just in terms of the local work as well, supporting this programme, as outlined in the paper, I really wanted to just draw your attention to the new webpage resources, which is available on the Healthy Shropshire site. The new page is called Stopping Smoking, and it does include a whole range of resources, tools, advice, information on how Shropshire residents can get support for quitting smoking. There is advice as well for adults on using vapes as part of their quit smoking journey with intention to stop smoking and ultimately to stop vaping as well. And in addition to that, there is a dedicated page on youth vaping. information, advice. It includes the position statement, which we've shared previously, and there is a toolkit of resources that can be used by anyone supporting a young person who is vaping and how to have those conversations. We are also developing a parent carer information leaflet, which will provide current information, facts about vaping, what we currently know, who to contact if there are concerns, and of course that will be available on the webpage as well.
Thank you, Gordon.
Thank you.
Apologies, I didn't mean to interrupt. I thought you'd stopped. Apologies.
No, that's fine. I was just going to mention the recommendations, but not sure if anyone has any questions.
So the first bit for me was, in terms of the response to the consultation, should it not be a health and wellbeing board response to the consultation? So could we develop a health and wellbeing response to the consultation? So I think we should send something in as the board. I still think there's the ask in terms of individual organisations. So I would expect the council and I would expect NHS organisations to respond to it. But I think it would be an obvious gap if we don't respond as a health and wellbeing board piece. And then in terms of the recommendations, Gordon, I think from the paper, it's asking for the Health and Wellbeing Board support to the proposal of vaping and task and finish group to lead the collation of responses for the Stop in the Start consultation, given many of the members of vested interest, as you talked about. I think I've picked that up and developed that a little bit as well. So I think there's an individual ask of organisations, but also then the Health and Wellbeing Board response to be developed. There's the ask in terms of supporting the recommendation within the policy paper about raising the age of sale of tobacco for those born after the 1st of January. I think that gets Rachel.
Yes, so I think the suggestion is that as Health and Wellbeing Board, we would support that, but recognise again people would need to go back to their individual organisations to look at supporting that. Just both DPHs, the Chief Medical Officer, the ICS and others are in full support. Absolutely. But the request is then to go back and support that. Yep.
And then to recognise and endorse the current proposed local activity related to smoking cessation and underage vaping, including the new smoking and vaping information on the website, on the webpage on Healthy Shropshire, as you've talked about, and then with our comms teams, it's not in here, but promoting that and continuing to push that is going to be really important. So thank you for that, Gordon. So I think you've got Health and Wellbeing Board support with all of those. And then the individual ask of us as leaders in terms of our own organisations to go back and develop the thinking around that as well. So thank you very much for that.
Thank you.
Okay, I'm going to keep us moving if that's okay. So healthier weight strategy, Bernie and Kathy, who am I coming to first? Bernie.
Great. Okay, thanks ever so much. And thank you, Chair. I think I can keep this quite brief. The draft healthier weight strategy was considered at this board's June meeting, and at that point the board supported the proposal to undertake consultation on that draft strategy, and we've received some really helpful feedback, I'd say especially from voluntary and community groups and other partners, and we've used that feedback to produce this finalised strategy that's been included with your papers today. And the strategy now incorporates a high-level action plan, and that includes like the rationale for the actions and the indicators that will be used to sort of together with other intelligence to monitor progress. And I think just in terms of highlighting, I mean, and listening to the presentations in this meeting, in terms of the actions, there's a lot of crossover in terms of the issues Jackie raised in her presentation, which is kind of unsurprising, really, given that obesity in particular is increasingly a disease of poverty. And so our sort of action plan includes reference to the need to promote access to Healthy Start, to promote access to free school meals where there's that entitlement, to staff training, both in relation to access to benefits. And like poverty, obesity sadly is also extremely stigmatised issue. So there's quite a lot of crossover with the discussions that you've had earlier. And I think I could leave it there, but very happy to take any questions from any board members.
Thanks. Thanks, Bernie, and thanks for that, and thanks for the paper. And of course, we've already we've previously talked about this, haven't we? Previously explored with some of this as well. So Ben, got his hand up there. Into you first.
Yeah, just a quick one. Just note your actions on page 5 regarding the NHS national standards for healthcare and food. Just to give some reassurance that we've progressed that. We have a new nutrition policy for the trust, and we've also just appointed a nutritionist to provide kind of oversight and direction for improving food provision within our hospitals. So we're on that.
That's great, because we've been really struggling to identify people to talk to about that. So if you could provide a contact, Ben, that would be wonderful. Yeah, great.
We've had fab and great this morning. I'll take that. I'll help them not being bored on a Thursday morning. Absolutely. Rachel.
It was just a brief comment. Firstly, to absolutely thank Bernie, Kathy, and all of the team for the work they've done victoriously on this, because this has taken us. It has taken longer due to a small thing of a pandemic in the middle of all of this, but it has actually the result that we've got in this comprehensive evidence-based strategy that moves us from just focusing on one area, how you in a very complex issue such as how we work together, to an absolutely systemised strategic response that will require all of us to be involved, but will move us all forward as a system in addressing this. So I just thank you for that, and I think thank you for the comprehensive response, and we will take these actions back through the Health and Wellbeing Board to make sure we track them and progress them in a kind of managed way.
Okay, really good stuff. So in terms of that, then the recommendations are endorse the healthy weight strategy for Shropshire and advise on reporting requirements. I think we've talked about that and covered that and would agree with that. The ask, which has been a repeated one throughout this, which is absolutely appropriate. Constituent organisations are asked to present the strategy for approval by their respective governing bodies. So I think we need to think about how best we do that to add value to the conversation, rather than just say, here's a report for a tick box. It's about how we bring it to life, rather than just do the process bit, because it'd be really easy for me to take it through a governance process that wouldn't achieve what I think you want with this, which is the awareness and the conversation and discussion. So Claire, Nigel, if we can think about how we best bring this to life, rather than just take it through a governance process from an NHS perspective. And board members are asked to support their organisations in partnership working to deliver the strategy over the coming 5 years. And I think whether it was housing, whether it was in terms of poverty and food, whether it's about weight, whether it's about smoking, the challenge and the real benefit, I think, of the conversations today is this is about partnership working, it's about integration, it's about organisations working together to make a difference for local people. That's the call to action on all of these things. And I think the board fully endorse and fully support that and reinforce that. And I go back to the comment that I made to Lynn earlier, which is where that doesn't happen, call it out and bring it back to the table, because we need to be having those conversations and discussions. So if that's, not that you need permission from me, but if health's not playing its part, then I expect somebody to tell me that health's not playing its part, because I can't do anything about it if we don't get that feedback and we don't get into that narrative. And I'm assuming that's the same principle for every other organisation represented around this table. Fully supported, endorsed, and the recommendations progressed as we talked about. So thank you very much, Bernie and Kathy, for that great work in this space. So thank you.
Thank you.
At this point, I'm just going to really quickly just move the agenda around slightly so that I can deal with the chair's report, and then I'm going to hand over to Councillor Motley to lead us through from the prevention framework and the joint commissioning piece. But given I've got the chair's report in front of me, it would be unfair just to leave that without having that covered. If that's okay, Councillor.
Yeah, absolutely fine.
The chair's report, just a couple of bits to update colleagues on. In terms of pharmacy update for the September SHIP board, Health Watch raised a question about the stability of local pharmacy, a number of local closures. We've been working, so Peter Procopa, Chief Officer of Community Pharmacy Shropshire. We've identified 47 community pharmacies within the Shropshire Health and Wellbeing area, 46 in the Shropshire Health and Wellbeing area. The closure was a former Lloyd's pharmacy within Sainsbury's. Of the 81 current pharmacies across the whole ICB, there's one 100-hour pharmacy, which is in Wellington and Telford. There have been a number of changes of ownership, largely due to the decision of Lloyd's to exit the community pharmacy market in the UK. But a few independent businesses have also changed hands. Most of the new owners are engaging in the provision of services outside of traditional dispensing, which is much more than under the previous ownership. So that's what's the local pharmacy offer is broader than just the dispensing piece, so it plays its role in the community. And then the pharmaceutical needs assessment was published in 2022, and work to update that will start in 2024. We also had a visit from Department of Health and Social Care on the 12th of October. So Claire kindly led that out. The focus was around our opportunity to showcase really integrated neighbourhood teams, integrated working, person-centred care, and really to show some of the fantastic work that's happening. The Oswestry prevention programme was talked about at that visit. The work, some of the work happening in different parts of the patch was talked about. The highly work where we're showing that partnership piece was highlighted as well in that space, and the feedback from DHFE colleagues was really positive. It's really easy, isn't it, to hear all of these things aren't working as well as we'd want them for local people, and that's important. But actually, there's some fantastic work happening as well. It's as important that we profile and showcase that as well and talk ourselves up at times. And then many of us, after the last Health and Wellbeing Board, joined Health Watch Shropshire in celebrating its 10-year anniversary. And I was able to give a short presentation at that, which was fantastic. So delighted to be able to support and endorse the work of Health Watch Shropshire. And then equally, since the last Health and Wellbeing Board on the 5th of October, and Jackie's left, well, as you referenced it earlier, we had a great one-day conference at Shrewsbury Town Football Club about the voluntary community sector engagement across the area. I mean, the room was packed, the noise was fantastic, the energy was fantastic, lots of thought-provoking conversations and great examples around the room in terms of the work of that part of our system, and a commitment my chair made, and I felt that we reinforced in terms of the health continued engagement and partnership with the voluntary community sector. As Jackie's picked up on, the council are streets ahead of us in this space, and you're made to be streets ahead of us in that space, to be fair, so I would expect it. But health has its role to play in terms of getting into that space more than it has done previously, and so that was the commitment we made on the 5th of October. And we've already talked about and covered the child mortality piece, so don't intend to go through that. So that's the chair's update for this morning's meeting on some of the other things that are happening that don't necessarily get put in the agenda as well. At that point, with your permission, and thank you for your support in helping me navigate this morning so far, I'm going to hand over to you, Councillor, if that's okay.
Thank you very much, and thank you so much for really getting us moving through that agenda. We've had a lot of discussion. I think it's been very productive, so thanks for that. Now, can we just move quickly on to the prevention framework, which is a great one of Rachel's initiatives. So can we just, Rachel, can we just have it?
Yeah, so I think so thank you very much. I think it's certainly, as you said, thank you very much, but I definitely think as a health and wellbeing board system, it's absolutely fantastic, phenomenal to see that we have been able to develop this. And I'm going to say a huge shout out and thank you to Jessie for coming and being part of this and help us develop. You'll be leaving us in a couple of weeks, but I think it's right at this point that I just say huge thank you to Jessie and all of the team who've helped pull this together. This is the first time we brought it to a public meeting. It's a draft document at the moment. We're almost there in terms of finalising the actual framework. The action plan itself will be a living, breathing document that will be developed. And as we develop actions through the Health and Wellbeing Board, through SHIP, through our Healthy Lives groups, they will make their way onto the action plan and we will be monitoring those. So there is work going on at the moment to refine the action plan, but the prevention framework, I think we're pretty much there with that. We have engaged considerably. Jessie, the team, Penny, Naomi, and sort of actively engaged, and it culminated in an event a couple of weeks ago, a stakeholder event, where we brought partners together to develop the framework based on some of the work we put together. There was some gaps around primary care engagement, and that we had the first session last night, and I'll bring Jessie in a moment to talk about that, and there's further engagement that will happen. The feedback overwhelmingly is to support this. It gives us a framework to hook and an approach that we want to hook our prevention approach on. It says to our system, to our population, that we believe in prevention. and that's primary, secondary and tertiary prevention, that we have an approach, we have a systematic approach to that, and we have some principles and ways of working. And so then there's some specific system-wide actions that get us to doing this at scale, not just doing it in pockets, but bringing that together, as well as our commitments of individual organisations. We're not taking away from that. The plan is, as I said, it's a draft, so we hadn't quite got it to this board to sign off, but we wanted you to have public sight. But we intend to get the framework signed off between this and the next board and bring the full action plan, draft living action plan, to the next meeting for people to view and see. And Jessie's pulling all of the many comments and feedback we've had together, which is it's really positive. And then we would want to bring certain actions for them through to this meeting to take forward. Jessie, I just hand over to you to submit any comments, because the primary care is kind of new feedback, and anything else you want to add in terms of those key themes.
I don't want to add anything massively, but as Rachel said, the primary care weren't able to come to our large stakeholder event in October, so 2 separate events were arranged or have been arranged. First of one was last night, and again, broadly supportive, definitely agree with the approach. The 2 key areas, I suppose, that were picked up on and perhaps need to be strengthened in the commitments were around sustainability and also deprivation, which has been a lot of discussion about today as well. So I'll look to do that following those. And then there is a second primary care event scheduled for next Thursday. There is bits of feedback coming in from other stakeholders as well. So I will make sure that all of that is pulled into the detailed action plans. And if I can also say thank you very much for having me. I've thoroughly enjoyed my time at the local authority under the guidance of Rachel and Penny and the colleagues in public health. So thank you very much for having me. It's been a huge insight and a definite stretch. So thank you.
Well, Jessie, thank you very much indeed for all the hard work that you've put in on this. I don't know how many of you on the table actually attended. I can see a few who did. Attended the prevention session, which Rachel led. I must say, I came away feeling that there was really something good coming together as a result of that, which was really good to see. So, does anybody have any comments or questions or anything? Yes, Penny.
Thank you, Councillor. I just wanted to say that I've presented, in support of the work, presented the presentation that Jessie and Rachel have pulled together at a few different partnership and internal meetings. And I've had really positive feedback about it. And just yesterday, somebody stopped me and said, oh, I was on that meeting. And I just wanted you to know it was really well put together. And it's not my presentation, I will add. It was just, so it is the work that Jessie and Rachel did. But just to say, it was easy to follow. They thought it's a really complex area, and they felt it was easy to follow. And pleased to see how the work that they do fed into it, and I think that will be replicated around the system. So I just thought that feedback was quite nice. Yeah,
very good, excellent. Thanks very much for that, Penny. Laura.
To comment really to say it's great. You know, I think we've talked about it for some time, haven't we, around pulling the strategy around prevention and that real focus on prevention and early intervention that so many people are trying to do. It's been done in pockets, and actually what it's doing is it's really pulling it all together and looking at the gaps and looking at where we need to focus our time and energy. So, you know, it's going to make such a massive difference, I think, you know, moving forward in terms of reducing crisis response. You know, so you're going to make my job, other jobs a lot easier if we can get this right. It really will, and let's get the resources and the support in the right place. So really great to see that. So I can't wait to see the final product and obviously really engaged with that. So well done all.
Thank you very much for that, Laura. That's very helpful. So we have an ask from the Executive Director of Health. Hang on, that's not quite right, but never mind. The board is asked to note the development of the draft framework to date and support the next steps as outlined in the paper, which I think we're all happy to do. And you'll bring it back. Would you want to bring it back to the next?
Yes, I think if we
the next
bring it back to
meeting,
the next
probably
board,
will. We need to keep the momentum up,
we do.
don't we?
Yeah.
Yeah, great. Okay. Thanks all for that. Okay, the Better Care Fund and winter planning. That's a really important one coming up. Laura.
Get ready. And again, Chair, I will be quick with this one. So the report that you see in front of you has got two elements to it. One being a bit of an update in terms of the quarterly return that we've got to do as part of the BCF returns, as well as the fortnightly and monthly and now quarterly reporting that we do. So just that I think it's what we've with the aim of that return, just to let the committee know, is very much focused on the demand and capacity work that we did as part of the 2-year plan. It was an opportunity to review what that looks like and with health colleagues to ensure that did we want to update it. And actually, once we did review the figures along with our health colleagues and what we were seeing, we did keep it the same. So we'll see where we go. I'm looking at across to other health colleagues across the room. We are seeing huge demand and pressures, we know. So it is based upon, what we think and what we know. I think it's useful just to point out as well, we're doing some further work as part of the BCF. I think I alluded to it in previous updates. It was provided as an opportunity for some support locally from John Bolton, who's doing some demand and capacity work with us and looking at where our focus needs to be in terms of those pathways and the resources that we've currently got as part of the Better Care Fund. So we're working through that with system partners on that, and then we'll need to action some of the things that will come out of that. But essentially, what we've seen within the targets and the metrics, we did a bit of an update as part of the quarterly returns. We're on track to meet most of the targets, but we are currently below the emergency admissions due to falls in people aged 65 and over. But we're hoping that the anticipated falls response that is going to go live next Monday.
Went live this Monday,
even better. Will hopefully have an impact and pull that target back, so we can get back on target for the next quarterly return. So essentially, as I said, an update on demand and capacity pretty much remained as is. Just a narrative update in terms of what we're doing around the demand and capacity work and the market and the wider stakeholder work, and the update on the metrics. So that has formed the return for this on this occasion, and then we'll get into routine of doing that on a quarterly basis. And then just really, I was asked to just provide a bit of an update on winter planning. So I don't plan on going through all of those elements, but essentially what it's done is it's picked out some of the winter plan as part of the partnership submission, which I think is still in draft. Or I think it's pretty nearly there from conversations with our health colleagues. So just picked out some of the points that again system partners are working on, from the Shropshire Council perspective and what we're working on. We've talked about some elements before, particularly as part of the winter response within the BCF. So we know we've got the winter additional support for the WIPS project, as we call it, has gone live this week as well. So that again is led by Jackie and colleagues in the voluntary and community sector. So I do need to probably pick your brains, Nigel, in terms of who to make sure the communications across our health colleagues goes to, so they can refer into that. I've just got some emails today asking for that, so I'll pick that up with you after. Again, falls response, great. It's gone live as well, so that will hopefully see additional support there. We've also got some bank staff as part of the start. Recruitment retention is still really good within start, and we're seeing improving performance of support of individuals going through the reablement service. And then just to make note of, and actually it might be that it comes forward, it's a future agenda item, but the virtual care support model that that's currently live at the moment, that went into pilot phase, but we're looking at expanding. I think it might be useful maybe to bring that at a future meeting, just to talk that through and what we're doing around some of the technologies as well. I think there's a huge amount of work going on. Probably highlight that and think about the opportunities to align with some of the virtual wards and the other projects that we've got across again the system. So that's pretty much the update for me.
That's great. Thank you, Laura. And it would be a very good idea, I think, to bring the virtual care support up for this board, so that we have a really good look as people really understand it. That'd be great. Penny, did you want to add anything?
Thanks, Chair. No, thank you. I think Laura's covered everything. I guess just to say that there's so much really positive joint working going on as part of this work, but also more in the integration work, the work that that we've been talking about throughout the board. And so I think, yeah, and this is no different really. So I think I feel really positive about a place we're in from a partnership point of view.
Great, that's lovely. Any comments from anybody else quickly? No. Okay, thanks very much to you for that. Right, now we move on and we're getting to the sort of bits we whiz through. I think there's a more elegant way of putting it, but that was the best I could think of at the moment. So the ship update, Penny. We're having a ship's meeting this afternoon, isn't it?
There is. So this part of the agenda is just for information. Yeah, so there, other than what is written there, I haven't got additional items. The only, I suppose, I would request that perhaps the neighbourhood working part of local care be brought to a future health and wellbeing board. I think would be useful to discuss here.
As a discussion item.
Yeah.
Yeah.
Yep.
Okay, thank you.
Okay, that's good. And the other thing was the JSNA place-based needs assessment and themed GSNAs.
Nothing really on this.
Great. Health protection update.
Only because it's winter. I think it's important to say it, just to remind everybody about the flu jabs and COVID jabs, and to make sure that everybody make sure that they get those, and I think the workforce as well. So I think it's a good idea.
And then the air quality update.
So we've already asked questions.
We have, yeah, absolutely, we've done that. Great. I think we've reached the end of this agenda. We seem to have done it in absolute record gathering time. So many thanks to you all for your contributions. And when's our next meeting's in January, isn't it, Rita? Yeah. Yeah. Great. Okay. Thank you all very much. I will now close the meeting. Thanks.
You crossing the